Everything you've been told about treating mastitis and clogged ducts is wrong. Today we're going to talk about the new guidelines set up by the Academy of Breastfeeding Medicine, their newest protocol on treating mastitis and clogged ducts. Now, it's not that we've been treating it all wrong, but we've been treating it differently. So generally, how we've been treating mastitis and clogged ducts was to try to keep the milk moving, try to move it more, try to break up any clogged milk that might be, stopping milk and causing that clog, that swelling, that, inflammation in the breast, try to get that loose and let that milk flow free. So, generally like that traditional advice of do lots of breast massage, soak your breast in a bowl of warm water, which honestly, that was my favorite. The soaking your breast and the massage followed by dangle feeding or pumping, like that was always my, kind of go-to advice. So when ABM decided to switch it up, I was like, excuse me. But I have heard from people that this actually is an effective form of treatment. So what is it? ABM protocol for treating mastitis and clogged ducts is now basically the opposite of everything we've been doing. So they want you to treat with ice, ibuprofen, nursing or pumping as usual, not increased, and not, massaging the breast unless it is therapeutic breast massage for lymphatic drainage, and no haka Epsom salt trick. So why is that? First of all, they're trying to treat the inflammation in the breast. Mastitis basically means inflammation of the breast. Mast, breast, itis, inflammation. So how do you treat inflammation in the body? With an anti-inflammatory drug. So ibuprofen. And ice. So just like you would treat any kind of other injury in the body where you have swelling, you want to rest and apply ice and take ibuprofen. And, obviously check with your doctor. Like, this is not medical advice. Check with your doctor before taking anything, because I don't know your medical history. You might not be able to take ibuprofen. But this is the protocol that they've outlined. So ice the breast, you would want to do 10 or 20 minutes on, 10 or 20 minutes off, until you feel like that swelling has gone down. So why decrease the pumping and nursing to just what you normally do instead of trying really hard to work and get that clog out? The worry is that extra nursing and extra pumping can increase the inflammation in the breast and actually make the mastitis worse. So, and also that extra nursing and pumping is going to increase the amount of milk you have. So it does make sense. When you think about it that way, it makes total sense that you don't want to exacerbate the problem by leading to more milk supply. So what about the breast massage? Now, generally, the advice that we would give would be to do lots and lots of breast massage. So generally the advice we would give would be to do lots and lots of breast massage on the clog, be first between the nipple and the clog, moving kind of back toward the clog, and then back from the clog up to the nipple before you try to get that out. So why is that a bad idea? Because when you're vigorously massaging, you're damaging tissue, you're damaging cells, and increasing the inflammation in the breast. And this makes sense. Every time I've had a clogged duct and I did the vigorous massage, it did feel like it helped to clear that, but also my boob hurt for days after. It felt bruised in that area because I was doing such hard massage trying to get that clog moving. So again, it makes a lot of sense. So therapeutic breast massage that they do recommend is very, very light. So it's basically just trying to move that fluid back away from the nipple, back really, really gently, really carefully along the breast, going back toward the armpit where you have lymphatic or lymph nodes there to kind of drain that fluid, that excess fluid that might have built up, you know, to aid in the healing. Because that's really what happens when you have any kind of injury or, you know, cell damage or anything like that in the body. It starts inflaming. That's part of the healing process. So all the fluid, blood, all rushes to that area to try to heal it, but that leads to those symptoms that are so painful and uncomfortable. Now, what about the haka hack, where you would suction the haka on when it's filled with Epsom salt to try to draw the clog out? Now, I've heard a lot of people say that this is really effective, but again, the issue is that strong suction on the breast can cause swelling around the nipple and, again, exacerbate the problem, increase the inflammation within the breast. So, again, ice, ibuprofen, only very gentle therapeutic breast massage, pumping and nursing as usual, and no haka hack. And I've heard people have success with this method. I personally haven't had to try it, thankfully. You know, most clogs, if they don't happen within the first 6 weeks of lactation, happen after 6 months. So it's those long-term nursers, that full-term nursing, when you get those clogs and mastitis a lot of the time. So you think you're in the clear, but not always. So that's it for right now. If you feel like you are experiencing symptoms of mastitis that will not go away, so redness in the breast, hot, you know, swelling, flu-like symptoms, achiness, fever, definitely call your doctor right away. That means it's kind of led to, or it indicates it's probably led to some kind of a breast infection. And at that point, you would need antibiotics, or there's some evidence that certain strains of probiotics actually can help mitigate mastitis and also prevent reoccurrence. So those are things to discuss with your doctor. If you have any questions, definitely, you know, drop them below in the comments. I would love to help. And if you like this video, I'd appreciate it if you liked and subscribed, send it to your friends who might find it helpful. And, you know, keep this in mind if you are expecting your first child or expecting another child and planning to breastfeed, that things have changed. To learn more about milk production and supply and really how all of that works, click this video over here, and I will see you next time. Thanks very much. Bye.